As we know that PCO patients have anovulatory cycles, that means there is unopposed estrogen which is acting on the endometrium and causing endometrial hypoplasia. So this endometrial hypoplasia. Hello friends, I am Dr. SHEELA. I am a senior consultant of obstetrics and gynecology at Bangalore. I am practicing at Anugraha Nursing Home, Vinayaka Circle, Palace Guthali in Bangalore. I have an experience of almost 38 years in obstetrics and gynecology, and I am also ex-professor and a HOD of OBG and currently working as a DNB faculty at KC General Hospital, Bangalore. I am the past Vice President of FOGSI, that's in 2014, as well as I was the Chairperson of Safe Motherhood Committee of FOGSI. And as a President of BSOG in 2005-2006, my main program was concentrated on adolescent health. Now, as this is a month for the polycystic ovarian disease, let us talk about it. All of you will agree with me that definitely there is a rise in the incidence of polycystic ovarian disease amongst all the age groups in India. We find many adolescents coming up with this problem as well as even the women in reproductive age group. And once they finish the reproductive age group, they continue to have this problem, and there are some health concerns in them if even after the age of 35, if they still continue to have the polycystic ovarian disease. Now, what is this polycystic ovarian disease? This is a metabolic disorder, and it can affect the women, those who are thin as well as those who are obese as well. Now, particularly in adolescents, we find that they do come to us with definitely their BMI is more for their age, as well as their periods are irregular. Now, what do we do with them? We don't find so much of metabolic disturbance in them unless and until there is a strong history of diabetes or other metabolic disorders in their family. So the main concentration on them is regarding the lifestyle modification. And I must tell you that due to the lockdown, it has really affected everybody's lifestyle. And the children particularly, because they are away from school, they do not have any physical activity, they are sitting at home, and all of us we know that they have only online classes. So naturally, this has made them to put on the weight. Now, one good thing about adolescent PCOS is that it is transitory. So whenever we see an adolescent with this problem, what is important is we have to counsel them, and we have to tell the parents and the mothers particularly that it is transitory and it will go. So, and the main thing scary is so many times the ultrasonology report itself scares them. So we have to see to it that everyone follows the proper criteria on ultrasonography to diagnose the PCOS. Okay, mildly polycystic ovaries, these things, these findings are not, that does not mean that the girl has polycystic ovarian disease. And we also have the Rotterdam criteria. So unless and until they fit into these criteria, we cannot label them as polycystic ovarian disease. Yes, if we find that they have irregular periods, they have put on a lot of weight, definitely what is required is to tell them about their diet and the lifestyle modification where the exercise is must. Now, medication differs depending on the age group. Now, most of the PCOS, when they come to us in reproductive age group, again they have irregular periods, they may come with acne, hirsutism, sometimes short period of amenorrheas and infertility. That is difficulty to conceive. And we have to investigate them for whether they are pre-diabetic or diabetic. As I already told you that it is a metabolic disorder, and if you really find that they are in overweight, obese or very obese category, we must also get their complete profile done, that is even the lipid profile, and they will need a proper counseling. They have to reduce the weight because weight reduction itself will help them to correct their 50% of the problems, as it is a metabolic disorder. Now, coming to difficulty in conception, yes, we know that they have anovulatory cycles, So they will definitely need assistance in the in way of ovulation induction. Yes, that also we have to do in them if they are not able to conceive. What is required is, suppose we have a PCO patient who we do the induction of ovulation, she conceives, we have to see to it that we have to screen them for diabetes during pregnancy. And most of the time we find that they are already having, they are pre-diabetic, or they have type 2 diabetes, or they are also prone to have gestational diabetes mellitus during pregnancy. So all the 3 trimester we must screen them, because they can develop diabetes at any stage during pregnancy. The second thing is, after the delivery, again after 6 weeks, we should call them for screening again to see whether their sugars are still high, and we have to counsel them and tell them that she is a high risk to develop diabetes in her later life or even in her second pregnancy. Then comes the elderly group, where they have already finished their family but still they have polycystic ovaries. They come to you with a short period of amenorrhea and a heavy flow, or sometimes with frequent menstruation. Now all of us we know that PCO patients have anovulatory cycles. That means there is unopposed estrogen which is acting on the endometrium and causing endometrial hypoplasia. So this endometrial hypoplasia need to be treated even though they have finished their family. So dear friends, as all of us we know that shortly we will be the diabetes capital of the whole world, and this PCOS is the another problem. So all of us have to really concentrate on the health of women of our country, and that is starts from the adolescent till they are with us, that is even the geriatric patient. So dear friends, let us collectively, I think, decide now that we will be really looking after all these girls. What they need is empathy. We should not be judgmental in them, and we have to give them assurance and see to it that they come to us and they follow our advice to keep them healthy. Thank you very much for patient hearing.